So, very first thing you have to remember in part 3 exam, that's definitely there that you have to be very soft spoken. You have to have like changes in your tone. It should not be flat. It should not be monotonous. But this, it's an absolute fact. It is. Everybody, please mute yourself. Everyone, that will be helpful. Everyone, please mute yourself. Okay. So it's very important that you have to have good command on guidelines on TOG. Basically, study or topic is equally important. If you have that myth that if you speak, softly, if you do not you will be very empathetic, you'll clear tasks. Definitely, that is very, very important. But it is not that if you are giving wrong information, you are going to clear applied clinical knowledge and patient safety. Though every domain has equal marks, but patient safety and applied clinical knowledge, these two domains go together, right? Because whatever you speak, if you are giving wrong information, you are compromising your applied clinical knowledge, you are compromising your patient safety both. So, especially who has just cleared their part 2, I would suggest to keep their part 2 material safe because that is going to be a great help. All guidelines, all talk, GTG, NICE, scientific paper, impact paper, everything is going to play a very important role. So if you have any printout, if you have any PDF, if you have anything on your desktop, laptop, please keep that safe because you would be needing that in all tasks, right? So I'll give you a little bit guidance while performing task itself, how to gather information, how to do introduction, what is agenda, like how you deal with communication with colleague, patient safety. So I want two volunteer for information gathering. I'm not showing tasks. I want to volunteer. I have to finish this I have one task and I have to finish in half an hour, 45 minutes. So be quick, girls. Two volunteers, please. Two volunteers, please. Speak up, girls. You have to be confident. You have to open up. If you can't speak here in free session, how will you prepare yourself for exam? Come on, come on, come on.
Ma'am, I can do.
Yes. Is it Hifza? Or
Yes.
Hello,
ma'am.
mention your name one by one, or I would suggest if you can put in your chat. So that will be
Ma'am, me Vasavi.
Vasavi
Ma'am,
and
me Hifsa.
Hifza.
Hifsa.
Okay, so I got two volunteers. Sarah, you have to present management part because you have not volunteered for IG, which was the easier one. So this is your punishment. Okay.
Okay, ma'am.
Okay. So Hifza and Vasavi, because Vasavi, you are present, you have just cleared your part 2. Am I right?
Yes, ma'am. Yes, ma'am.
Okay, so first, I'll give chance to Hifza, so you'll get an idea how to do the information gathering introduction. See, basically, I always divide my each task in two parts: first part and second part. First part includes information gathering, agenda, and the information gathering with examination. Second part starts from BBN, investigation, diagnosis, and the management. So basically, part 2, it has communication with colleague, patient safety, applied clinical knowledge, and of course, patient communication. Okay. So Hifza, this is your 2 minutes. And after that, I'm not going to give 2 minutes to anyone because everybody is going through tasks.
Ma'am, first slide. This one.
This is SPT and you will be assessed for all the domains. This is the only important slide.
Yeah, this one.
You have to finish your information gathering at the max in 5 minutes. Sarah, you will
Okay, ma'am.
keep an eye on time. Start your stopwatch. I'm preparing you for to be a mentor. I'll hire you once you clear your exam. Two minutes over, Sarah?
Sorry, ma'am. I just.
Ifza, 30 seconds to go.
Okay, ma'am.
Start.
Hello, I am Dr. Hifza, one of the doctors in Gynae Clinic today. Am I talking to
Very
Diana,
first,
47
I am
years old?
going to interrupt Hifza in each step where
Yes,
you are
ma'am.
going to perform wrong. Why? Because if I interrupt you then and there, you're not going to forget ever in your life. And this is be easy to understand for all new joining. Always mention your designation. So what is
Yeah.
your designation?
Yes. ST5. ST5.
What is the name of clinic?
Gynae Clinic.
Yes. So you have to start all over again.
Okay. Hello, I am Dr. Hifza, NST5 in Gynae Clinic today. Am I talking to Diana, 47 years old?
Yes, I'm Diana, doctor.
How you would like to be addressed?
Mrs.
Diana is okay?
Mrs. Diana would be great, doctor.
Okay. Mrs. Diana, I understand from your notes that you are having some concerns for which you are here to discuss about. So, is that so?
Yes, doctor. I don't know what is happening to me. It's been like a couple of months. I have lost all my interest, my sexual activity, and my husband, John. Otherwise, he's very supportive, doctor. But definitely, it is affecting our relationship because we are together for last 4-5 years only. So I don't know what to do with.
Yeah, I can see, Mrs. Diana, that you are passing through a lot. We as a team of doctors are here to support you and to help you, and we will guide you regarding your further management plan. But before that, is it okay if I ask few questions?
Hifza, don't be monotonous. Don't speak as you are
Okay.
reading some news. There is no emotions there. You have to bring emotions. You have to increase your tone, and sometimes you have to decrease your tone. You have to have some feelings. At least you have to show that. It is appearing that there are certain
Okay.
lines written in front of you and you are reading. Don't do that. Whatever you said, that is absolutely perfect. I have no complaints. Whatever you have said, that is absolutely right way to acknowledge somebody's grief. But I should feel that you are literally meaning it. You meant it, whatever you're saying. And it will only come when you will say with some emotions. Repeat.
Okay.
Sarah, again 5 minutes, will start from beginning.
Hello. Hello, I am Dr. Hifza, NST5 in Gynae Clinic today. Am I talking to Diana, 47 years old?
Yes, doctor, I'm Diana.
How you would like to be addressed?
Diana is fine.
All right, Diana, I understand from your notes that you are here to discuss about some concern. Is that so?
Yes, doctor. I'm with my new partner for past 2 years. And I don't know what happened to me in some months that I don't have any interest in sexual activity. And John is not very happy with this. It is affecting our life. Like we may have even breakup, doctor, and I don't want to do that.
I'm so sorry to hear about that, Diana. I can understand that you are passing through a lot. Make sure that we as a team of doctors are here to help you and to support you
Lovely.
through this difficult time.
Lovely.
And we will
Lovely, Yvza, lovely. Sarah, Vasvi, now how was her presentation now?
Yes, ma'am. I can get it out.
Right? Now she is so
Yes.
sounding empathetic. It is Vasavi, as you are, I think,
Yes, ma'am.
I don't know whether you have attended any other session for anyone. This is how you have to sound, that you are really concerned for your patient. It should not come with your words only. It should come with your gesture, your body language, your facial expression, and your tone and voice. It should be a complete package. Clear? Hifza?
Yes.
Yes, ma'am.
Now you have done a brilliant job. Move forward.
So, Diana, we as a team of doctors are here to help you and to support you through your further management. But if you don't mind, Diana, I would like to ask few questions to know more about your condition. And then I will also discuss with my consultant, and then I will explain you your further management. How does that sound, Diana?
Very first thing, never say don't mind. Always remember
Okay.
that we are not supposed to use jargons, but we have to be formal. Try to understand difference between using jargons, layman language, and difference between being formal and informal. At the end of the day, you are a doctor and she's your patient. You have to be formal with her. You have to use layman language, but very formal language. Do not mind it's something which we do not take it as like, it's not a positive statement. Normally, when we like use this phrase, when we are talking to our friend and we do not like anything, like we say, please do not mind, but this is not the right way of talking. Please do not mind, but you're not saying right. Please do not mind, but this dress is not suiting you. Isn't it, Khushbu? Katiza? Whatever I'm saying, do you agree with that, Om Priya?
Yes, ma'am.
I want two-way conversation. I do not like one-way conversation that I'm speaking and everybody is only listening. Probably I might be
Yes,
wrong.
ma'am. Yes, ma'am. Very true. Yes, ma'am.
Right? So we never
Yes.
say do not mind I do not take do not mind as a positive phrase. For me, it is a negative phrase. Hifza, and at the end of the
Yes,
day,
ma'am.
you are a doctor, she is a patient. You have to be very soft and delicate with her, but do not use any phrase which is not appropriate. Right? So please
Okay, ma'am.
rephrase your agenda. You have done your agenda, then consent for asking questions. Please rephrase and represent.
Okay, ma'am. Diana, Diana, if you allow me, then I would like to ask few questions to know more about your condition, and then I will discuss with you about your further plan of care, and I will also take the help of my consultant during your management. How
Make it
does that
shorter.
sounds to
Make
you?
it shorter. Make it shorter. You taken consent in 3 lines. In part 3 exam, there is fight against time. There is race against time. Can you rephrase it in one sentence, please?
Okay. Um, Diana, if you allow me, then I would like to ask few questions to know more about your condition.
That's it. Consultant will come in the end because as your starting is to the point, crisp, your and has to be to the point, crisp. So always include consultant when you are ending your task. Okay?
Okay.
So this was
Mm-hmm.
Yeah, doctor, please go ahead.
All right. So, Diana, what exactly, ma'am? Actually, I
No,
just forgot.
no,
Okay.
because she has already informed you about your condition little bit, right? So
Yes.
rather than saying ki asking same thing like tell me about your condition
Hmm.
something, say can you tell me more about your condition? Otherwise, she's going to repeat whatever she has said already.
Yeah.
So it is going to.
Diana, can you? Hmm.
Hmm.
Diana, can you tell me more about your condition?
Yeah, doctor, for sure. As I told you, everything was fine earlier. And I had a surgery approximately 1.5 years back because I had that painful menstruation and endometriosis because I completed my family. So Dr. Roser advised me for surgery. And after surgery, everything was fine for say 4 or 5 months. Then I started noticing like uh, menopausal changes, and Dr. Roser already made aware of me for that. Like I'm going to have some hot flushes and this
Mhm.
mood swings and night sweats. So I went to GP and he put me on paroxetine. I was fine after that.
Mhm.
I don't know, in last couple of months only, there is no problem in sexual activity. I do not have any pain or something, but definitely I do not feel uh, like arousal. I do not enjoy foreplay even, doctor.
Mhm. All right. Diana, do you feel dry down below?
A little bit, not much, doctor. It is, I'm telling you, now, there is no other problem other than these two, three for which I went to GP and I was all right after medicine.
Okay. And pardon me, some of my questions might seem intrusive. So shall I proceed?
Yeah, that's fine, doctor.
Okay. So Diana, may I know about your sexual frequency? How many times you have sex in a week?
I told you, doctor, I have no interest. So even if he is approaching me, I don't like. Absolutely wrong
Okay.
question, Ifza. Absolutely disastrous question. Tell me one thing, what is the significance of this question in making your management and the diagnosis? Any significance?
Mhm.
Do not waste your own time, okay? Move forward. What should be your next question?
Okay. So, ma'am, in this case, for this case, we will assess her for the condition like she is having decreased libido and dryness and her decreased frequency, and then further we will assess her for the for HRT.
Always make a rule, everyone, Sara, Hifza, Khushbu, Vesvi, and everyone who has joined recently. How to, the main problem is that you guys are not even able to understand what is HOPI all about in this particular task. Am I right or wrong?
Yes, ma'am.
Okay. A tip, whatever is given in your task and in your investigation report, if they have provided anyone, that is your HOPI. So what is HOPI here? What all three important headings you can see?
Ma'am, her
Decreased
decreased libido, surgery,
PLH for endometriosis,
and
and third is hot flashes.
her paroxysm.
And
Hmm.
always ask Sarah in a retrospective manner. Whatever is latest is going to be first. So first is decrease libido. So first question, can you give me more information about it? Right? Second is about,
Hmm.
see, you ask nicely. Rather than saying how many times you had this thing or you try, what should be your second question? Anyone. First, you ask, give me details or give me more details. Rather than saying, give me details, she probably going to repeat whatever she has already said in agenda. Can I have more details? Would you like to tell me more about it? So she will definitely give you some more and new information. One very important question, when she's saying, I do not have any interest in sexual activity, whatever she has informed, what is one very important question if she has not informed, you are supposed to ask anyone? Brainstorming, use your
Ma'am,
mind.
her foreplay.
Duration.
No.
No, is she having any pain or bleeding during sexual intercourse or just
Lovely. Who
loss
is
of
this? Who
interest?
is this? Who is this? Who is this?
Katija.
Who is Nafiza?
Katija, ma'am. Yeah.
Khatija. Okay. Lovely. There is a possibility that she might be having any painful intercourse. She might be See, if you find anything painful, are you going to do that? Sarah? Of course not. So she is having decreased libido. Probably she might be having painful sexual activity. That's why she is losing her interest. And which is very much possible because she is post-menopausal. Though it's a surgical one, heterogenic, but it is a menopause. So what should be your second question? Any problem in sexual activity? Any dryness down below, which you did ask? Hafiza? You
Yes,
did
ma'am.
ask vaginal dryness, but you should have asked one more question. Any problem, any difficulty, or any painful intercourse? If it is going to painful, obviously she is going to lose her interest, no? So
Yes.
first is details. Second, if she has not included herself, then is it a painful intercourse? Do you feel dryness down below? Have you taken any treatment so far? Probably GP must have written something, or probably GP might have offered him something like some vaginal cream, some estrogen cream. So everybody got my point. What should be the first HOPI? It should be about decreased libido, and decreased libido includes three questions: any perimenopausal, menopausal, or postmenopausal women. If you will have holistic approach, you are not going to miss anything. Holistic approach means if you think beyond medicines, beyond surgery, you will definitely you will be able to think as the patient is thinking. Am I clear about this? Okay, Hifza?
Yes, ma'am.
So second
Yes,
question
ma'am.
should be about endometriosis. She has already informed most of the things about her endometriosis surgery. What should be your only question? Whenever there is surgery, she has already informed that I had grade 4, I completed my family, my Dr. Roser has advised for my this and that. So I went for surgery, I underwent surgery. What should be your only question?
Has she been
Yes,
started on
lovely
hormone
Gayatri,
replacement?
lovely Gayatri. How was your recovery? Always remember, when you are addressing a patient after surgery, and that is included in HOPI, you have to ask first, what was the indication of surgery? Right? How was your recovery after surgery? And if you think that anything specific she should take care of after surgery, like PFMT in a case of SUI, then you are going to ask specifically about that. These three are standard question. And what is the last and very important question? If it is relevant, though it is not relevant in this case, but if it is relevant in like any other case, what should be the last case? No, HRT, she's already taking this paroxetine. Yeah, you can ask otherwise, Shristi, that have you been offered any HRT? Probably she will say, no, I went to, but yeah, HRT you can ask. One more question. HRT you can definitely incorporate. One more question, which is not very relevant in task, but otherwise, if any surgery you are going through, if you are discussing about any surgery being performed, no, not very relevant, not very relevant. May I go through your case notes? Isn't it? Sarah, you shook your head. Though it's not very relevant here, because we are not going to perform any other surgery. She has not come with any post-operative complication. Otherwise, Hifza,
Yes, ma'am.
it is very important to ask, may I go through a case note? Though you can skip this question here because it is not going to affect your treatment. If a patient is coming like anything which he had any post-operative complication, or you need to perform another surgery, in that case. So what all question we are going to ask in a surgery? One, volunteer, please do it fast. It's already 11:30. Quick, girls. Any volunteer, speak up. Here you will understand how to
Hello.
speak without any fear. Yes. Who is this? Tell me
Yes,
your
ma'am.
name and speak.
Om Priya. ma'am. Om Priya.
Yes, Ompriya, lovely.
Hello, Om Priya. ma'am.
Yes, sir.
For surgery, yes. How was the indication of the surgery,
Hmm.
and how was the recovery?
Hmm.
Any when was she discharged? Yeah, it will come in that. How was the recovery? Any complication post-operatively?
Hmm.
And may I go through your case notes?
Lovely. Hifza, so what question you should ask in second HOPI?
Ma'am, I will ask about how was your recovery after the surgery?
That is all. That is all.
Hmm.
Okay. So these two, and there is one more this thing. This will come between this and this. So first HOPI is decreased libido. Second HOPI is paroxetine. This thing. She's
Hmm.
Half of the thing already given. So what should be your question?
I will ask about what treatment you are taking, as she is taking
No.
paroxetine.
It is
So,
already given. It is already given. So what should be your second
how
HOP?
so are you taking the medication regularly, and how your symptoms been improved
Lovely.
of hot flashes? And
Lovely.
hmm.
Do you find any improvement in your symptoms, or how are you feeling now after taking drugs, whatever? And third is going to be about surgery. So this is your HOPI. Now you understood about HOPI, Hifza?
Yes, ma'am.
Everyone, this is how you have to understand what all you are going to include in HOPI. Whatever is given in task, whatever investigation is given, that is your HOPI. If you think that way, there is no reason that you are going to miss anything in your HOPI. Yes, Shrishti, it's indication, recovery, any complication, case notes. Lovely. Now, after that, move forward, Hifza.
Yes, ma'am.
Okay. Move forward.
Uh,
Yeah.
mm,
So this is your HOPI,
ma'am,
right? Now move forward
it's
for
okay, I completed. Yeah. For Diana, for any other problem, are you visiting your GP?
No, doctor.
Do you have any other medical illness?
No, I'm all fine, doctor.
Okay, other than paroxetine, are you using any over-the-counter medication?
No, doctor.
Any medication or food allergies?
No, doctor.
Okay, any personal or family history of clots in blood channels?
Never, doctor.
Any history of sinister disease like any cancer of womb, neck of womb, or breast?
Why are you asking this question, doctor? Am I having cancer?
No, Diana, actually, I don't want to scare you. It's for the we might need to give you some treatment. For that, we have to be sure regarding your history. So that's why I'm asking you.
No, this is not a right answer. This is very long answer. Quick answer for this. Am I having cancer, doctor? Why are you
We
asking
are
this
just,
question? Yeah,
Diana, I don't want.
we are just
Mhm.
concerned about our patients, so we are asking in general for all our patients.
Do you ask cancer question to all your
We are
patients?
just concerned
Who is
about
this?
them.
No. First tell me your name. Who is this?
No, ma'am,
Who is this?
this is Katija, ma'am. Just in case,
Khatija, tell you are saying that
this is
we
Katija, ma'am.
Khatija, you are saying that you ask this question to all your patients. Do you ask cancer question to all your patients? No, no?
No, ma'am, not for all patients.
Yes. So what
But
will be your
mm,
acknowledgement? What will be your
but
acknowledgement?
if at all we have asked patient,
Yeah. Come on. This is the
if
time
at all we asked for any screening or about cancer, we just acknowledge us. When we just acknowledge us, we just are concerned about the health of the patient, so we are asking some general questions.
Anybody else wants to try this answer, please? Anybody else? Come on, girl. This is the practice time. If you don't practice now, when will you practice?
Ma'am, usually we ask about family history as if we want to prescribe her HRT, then she would be at risk if she has I mean the
Sarah,
first
one
degree
line.
relative of
Simply, Sarah, never say no.
okay.
Hifza, she said, am I having cancer? You said no. Never say yes, never say no. Diana, just to understand your condition better, I'm asking this question. One line and you're sorted.
Okay.
Just to understand your condition better. That should be your to the point reply. Try to make to the point reply. Because you do not have much time. Because you have to finish complete task in 10 minutes. If you give explanation for every damn thing, you won't be able to finish your task. Trust me on that. So restart your this thing family history. Gives a
Hello.
Yeah.
Excuse me, ma'am.
Yeah.
Shashi, ma'am.
Yeah, Shashi.
Ma'am, I just want to know, suppose if a patient is of cancer, in that condition, sometimes it happens, like when I'm doing practice with my role player and she's asking, no, why are you asking this doctor family history of cancer? If I'm having cancer, why are you asking this?
Same.
Then what
Same.
to
Your
answer?
answer will be same. There are two types of tasks you will get in cancer. Either a diagnosed cancer, right?
Mm-hmm.
When there is a
Yes.
diagnosed cancer, then there is definitely you are going to say that I want to understand if there is any family history in your cancer. If you can, any family history of cancer in your family. She'll ask, am I
Okay.
having a cancer doctor?
Yes.
If you have a histopathology report which is saying that she has ovarian cancer, you have to admit then and there. You want to understand your reports now, Diana, or can I ask you more question? No, doctor, now I'm scared. Why are you asking this question? I can see that you are alone here. I have to share difficult information. Can I proceed? Yes, I have confirmed your name and NHS number. It is showing this report. And I'm sorry to say that this report is saying that you have ovarian cancer, grade 1, grade 2, or whatever type of cancer.
Okay, ma'am. We have not to stretch it. Like it
Of course
sometimes
not.
happens.
Of course, but if she has come with the RMI that is high, what does it mean?
Yes.
If RMI is high, what does that mean?
We'll
She
have to
has
go
a
for further
risk of,
investigations.
It means
she has
you
a risk of,
cannot say clearly that she is having cancer, but she has high risk of cancer. There is difference between two, right? High RMI doesn't mean that she is going to have cancer. It means that 7 out of 10 women with this report may have high risk of having cancer. So if it is a case of something like that, where there is a probability but not confirmed, you will simply say to know your condition better to decide about your management. Still, if say, but doctor, I'm scared, am I having cancer? Then see, there is again a big myth that we have to be very empathetic. Empathetic doesn't mean that you will not speak facts to your patients. You have to say that, okay, in that case, you would not want me to explain your report first. Yes, doctor, go ahead. There is a possibility that in the beginning itself, sometime patient will ask. There was one task in my exam, patient was with syphilis, screening report, positive, right? And in the beginning, am I having this? Am I having this? She was continuous. She was not allowing me to move further. So I decided then and there, okay, let me explain your report first. This is a screening test. This doesn't confirm syphilis. We will move on with further other tests and we'll confirm it. Then she was quiet. Simply, if you do not address role player concern, she is going to be very difficult to deal with. And secondly, if you give any wrong statement again, so rather than saying, and simply say, here in this case, if you ask about cancer, Hifza, by any chance, simply say to understand your condition better. Because here there is nothing much about cancer, no?
Yes.
Yeah. Move forward.
Yes, ma'am. Yes.
I have 15 minutes left. Move forward here.
so Diana,
Yes, Srishti, you write this nicely that to guide your management further, I need to ask this. Lovely, Srishti. That is the way you have to reply difficult question in one line. To the point, Chris, patient is going to understand. If you will beat around bush, it is not going to help you. Trust me on that. Yeah, Hifza, move forward.
Yeah. Diana, may I know your weight to height ratio?
Yeah, it's 29, doctor.
And do you smoke or drink alcohol?
No, doctor.
Pardon me, any recreational drugs?
No, doctor.
Okay. Thanks, Diana, for sharing all the information. Anything you want to add on?
No, doctor.
All right.
Did you
Next,
ask
ma'am,
drug
examination.
allergies? Did you ask drug allergies?
Yes, ma'am, I asked. When I took the medical history, side by side I asked for drug allergies.
Did you take my mental history?
No, ma'am.
Don't you think it's very important in this case when she is postmenopausal?
Actually, yeah, ma'am. Actually, when at the start she show her concern that her she is passing through a lot, and ma'am, after that, if we will ask again, then at the end we will attach her with some support group and a counselor.
Sarah, telling me one thing, Sarah, this is a question for you. What is the difference between having a mental health disorder and having a certain emotions? Are both the same things?
No, ma'am.
Today I had a fight with my son and I'm feeling very sad. I'm unhappy. Does it mean that I'm depressed and low?
No.
Hifza?
It's the emotion.
Hifza?
Yes, ma'am. Then we have to ask that in how you are
And
feeling in last couple of days.
secondly, I may be a patient of depression and I'm taking a certain medication. But probably you have come to meet me and you find me like I'm like just like bubbling around. I'm very happy. Right? So does it mean that I
Yes,
don't have that condition, depression?
ma'am.
Or
Actually,
a depressive a patient always cries, or sometimes he may or she may have bouts of happiness. You have to understand a difference between emotions and mental disorder. Mental history is not for emotions. Mental history is to rule out any mental health condition. So she is sad here because her partner is not happy with her. But probably it's not necessary that every sad patient is going to be having a mental health condition or going to be depressed. Clear, Hifza?
Ma'am, actually, yeah, ma'am, I am getting your point. Actually, I was thinking that when we ask about for any other like problem, you are visiting your GP and we are asking about any other medication you are taking. So there and then we are deal with this and also any physical and mental disorder.
Then why it is said that you have to take mental history? This college must have thought about it, no? That when they will ask about mental condition, they'll discuss about mental health condition as well. If college had made it this way, they must have thought something. No, this is not a format which I have made or someone else has made, right? This is a format which we are following for MRCOG for past many years. Getting my point, Hifza? Hifza, are you
Yes, ma'am.
getting my point?
Ma'am, sometimes when we ask, yes, ma'am, I got your point. But sometimes when we ask specifically again for like how you are feeling in last couple of weeks or months, are you feeling depressed? So ma'am, they say the role player answer, doctor, as I have told you earlier that I am feeling, I
Yes.
am
Now the
depressed.
catch is here.
Yeah.
Now the catch is here. There are two type of tasks. One task when patient has come with say Marfan syndrome or like any XYZ, let's say EDM, right? And she has come to understand a management plan. And a patient who is going through a tough phase like having SUI or like having overactive bladder or like having heavy menstrual bleeding, and now she has come here for the management. So what will be the difference in mental history, how you are going to take it? What will be the difference in acknowledgement? Anyone? Maliha?
Yes, ma'am.
So a patient who is going through some difficult time, like this patient who is having like decreased libido, now you have to take mental history. What should be an extra line which you are going to speak?
Have you
As I
been
can
normal
s-
prior
Let
as I can
before
see
the
that
let Malia
have
do.
you
Let
been
Malia do first,
seeing
please.
the
Let Malia do first. Malia.
as I can see that you are having stressful situation, but have you been feel low or
Lovely.
depressed in last couple of
Done,
weeks?
Malia. Well done. Malia, well done. Hafiza. Whenever patient is
Yes, ma'am.
coming with something like this, you have to signpost before taking mental history. I can see that you are going through a tough time. Just to be precise, are you feeling low and depressed in past couple of weeks? Sarah, am I sounding correct or not?
Yes, ma'am.
So can you repeat this for me?
Okay. As I can see that you are having depression and taking medication for this. Are you feeling low or depressed for the past couple of weeks?
Lovely. Gayatri also said it nicely. I can see that this situation is taking an emotional toll, but how you have been feeling low and depressed. Lovely. Lovely, Gayatri. Well done. So, Hifza, you have to signpost in a case like this. When patient
Okay,
is
ma'am.
already coming with some situation which is disturbing her emotionally or disturbing her quality of life. Clear about this?
Yes,
Okay.
ma'am.
Vesvi, are you there? You wanted to present information gathering? Vesvi, are you there? Or should I take someone else?
Yes, ma'am, I'm there, ma'am.
Okay, so Vesvi, now Hifza is going to be a role player. Hifza, be a gentle role player. I think she's. Have you presented tasks anywhere, Vesvi, earlier live session?
Yes, ma'am, I've presented a few tasks, ma'am.
Okay, so Hifza, do not be very lenient.
Okay.
Start. Sarah, now you will be her examiner. And 5 minutes. You will note down every line which she is missing, because if you know the task, only then you will be able to understand what all she missed. And this is for everyone. Everyone is examiner for Vasavi now. And I would see how many of you are able to point out her mistakes. The time starts now. Vasavi, your time starts now, dear.
Yes, ma'am. Hi, hello. I'm Dr. Vasavi, one of your doctor in gynec clinic today.
ST5 in gynae clinic, mention your designation. I just asked Hifza to just.
yes, ma'am. Yes, ma'am. Hello.
Present your.
Hi, hello. What would I like to call you?
Diana is okay, doctor.
Okay. Hi, hello, Diana. How are you?
Yeah, doctor, I am good, but I am very depressed for last few months that doctor, I am having some problem related to my sexual life.
Yes, Diana, I've come across your notes and I've aware of that you have symptoms of decreased libido for past 7 months. Am I right?
Yes, doctor, actually, I have no interest in my sexual life and my partner. I am with my partner for 1 year, and although very good to me, but now I'm thinking that my relationship is at a stake of breakup. So I'm very much worried. I don't want that.
I understand your problem, Diana. Could you let me know a few couple of questions so that we can have a better understanding on this?
All right, doctor.
When was your symptoms have been started exactly?
Doctor, actually, I had surgery 1.5 year back, and in which my womb and also my both ovaries were removed. And doctor told me that it is my best treatment, so I go for that. And after that, doctor, I am having for these symptoms. I was having some other symptoms, and for which I am taking some medication. But for the last 7 months, I am having this decreased desire.
Okay, I can understand that. Is there any associated symptoms like pain during your intercourse, and is there any burning association near your below down? Is anything like that?
No, doctor, actually everything is okay, but only the desire is low. Otherwise, I don't have any problem.
Okay, fine. Are you on any significant past medical history? Like any history of apart from anything else?
No, doctor.
No. Is there any apart from your hysterectomy background, is there any significant surgical history?
No, doctor.
Okay. Is there any which is a significant history in your family runs to?
No, doctor. Why you are asking about that?
Like for a better understanding and for few information can be gathered up so that I'll have a better management plan for you, Diana, so that I'll have a
So much
few.
long acknowledgement. Repeat your question, Hifza, and reply in this one line.
Doctor, why you are asking about that? Is everything wrong with me?
No, Diana, it's everything seems to be okay.
Never say
but
no, never say yes.
okay.
Never say no,
Okay, ma'am.
never say yes.
Shall I continue, ma'am?
Restart, Hifza, ask your question again and rephrase your answer, dear.
Yeah.
Ma'am, what will
Why you are
pardon me, ma'am.
Mhm.
What will be the best suitable answer for this,
That
ma'am? If there is,
I've already given 3-4 times. We have discussed almost 10 minutes for same. You have to reply this.
ma'am, I'm not getting it out.
Vasudev, I'm not an easy mentor. I'm not an easy mentor. I'm a very difficult.
I've just missed out, ma'am, few
Oh,
lines in
then you
between.
take your. I'm giving you 1 minute. Phrase
Yes,
and
yes,
sentence yourself. You are all postgraduate. This is not something which is out of the box. Probably you might have faced these questions in your clinics as well. I'm giving you
yes,
1 minute time. Phrase your answer and it should be in one line only. And nobody is going to write anything in chat. If you are intelligent enough, Vasvi, go through chat. But nobody is going to help you. I want everybody attentive with the one question which we have discussed for almost 10 minutes. Vasvi, you didn't get it,
yes.
then this is my failure. This
No,
is
no,
my
ma'am.
failure as mentor.
Diana, few cancers runs in our family too, so there is a need for asking the question, information on that. Is that okay?
Uh, okay, doctor.
Okay, fine, that's good. Can I ask you a few more questions, Diana?
Yes, doctor.
Uh, what about your waterworks and your bowel opening?
Yeah, they are fine, doctor.
Okay, that's good. Is there any drug allergy?
No, doctor.
Okay. How is the support in your home?
Yeah, sport is good, doctor.
Okay. Do you feel any low mood in past of a couple of weeks back?
Yes, doctor, as I have told you earlier that I am very much worried about my condition. So that's why I feel low. It's
Okay.
there.
Okay. That's fine. Uh, uh, Again, like I want to examine, like after like asking few questions, I want to ask you whether would you like to ask me some few questions more about your condition, Diana?
Okay, doctor.
Would you like to ask me some more details, or you want to proceed with my examination?
Okay.
Shall I do your examination?
Okay, doctor.
Okay. I would like to examine in the presence of chaperone your tummy down and down below and your tummy. Is that okay for you?
Okay, doctor.
Okay.
So now, one by one, Sarah, you start from you. How was her presentation? Will you pass her in information gathering?
I think yeah, she asked most of the history that's required, and she's empathetic. But I think she missed her BMI and also social history like smoking, alcohol.
Okay.
That's okay.
Okay. Next volunteer, everybody give your feedback for her. What she missed and where she was excellent. One by one, everyone kind fast. Second part will take more time. I don't like this kind.
I've missed about smoking, alcohol, drug recreational.
Other girls, I want your feedback about Vasvi's presentation. I want, if you are not able to take out any mistake, it means you are not well versed with the task. As simple as that.
She didn't address, she told that
One by one,
Ma'am, she
one
didn't ask about the
by one, girls. Tell your name and then give your feedback.
Ma'am,
Yes.
ma'am, she didn't ask about the drug history.
Mm-hmm.
Might be she taking some drugs, because of that she's having this problem.
ma'am, she didn't acknowledge this. She told that I'm depressed and low in the beginning.
Speak little louder.
Yes, ma'am. Actually, when the patient role player says that I'm down and depressed, she didn't address her concerns. And sexual history, as Dr. Sarah told, sexual history, drug history, was she compliant with medication? And the sequence you told that we have to ask about the HOPI libido first, and then the surgery, and then the compliance of medication.
Okay. Anybody else?
And may I guide?
Yeah, sure. Everyone.
Ma'am, you told that. Yeah, we have to told like
first,
we are asking.
Kathy is saying everybody quiet. Yeah.
Yeah, first it would be more appreciable if she would have asked with an open-ended question. It was after setting the agenda, she started, how is your pain, and was more definitive. So it bought some time, I felt. Secondly, when she talked about the surgery, when the role player said about the surgery, I think she missed asking how was the recovery, to know a bit better regarding the condition. And then a few of the other history, and she did not, she was more of like reading more of a template sort of thing, rather than, I felt that it was not like a conversation, because at times her sentences were too long and she was not coping up with what the role player was trying to say. Like for everything, she had to at times signposting, at times acknowledging. These things were missing, I felt, in information gathering. So these 3 points I felt need to be worked upon.
Anybody else wants to give her feedback? It was good one, guys.
Ma'am, regarding paroxetine, which she is taking, I think she missed that a little bit history about that, and also again and again asking for permission to ask some question. I think it was repetition. Otherwise, she did well, but these things, like once we have take the permission to ask more questions, then after that, I think we should take the history.
So what's your understanding about task now, Vasvi, after so many feedback? Where you're supposed to...
Yeah, ma'am. Yes, ma'am. I have to improve little bit on asking the questions which are
Like
not according to the...
What all you missed?
I've missed about recovery period of post-operative recovery period, ma'am, and smoking, alcoholic and drug recreational. And she was using a drug. We have to ask from how long she's using. She's complained of the drug, and her symptoms have been better after taking the drug. All those things, ma'am.
Okay. Okay. So now let's start with second part of the task. 2 volunteer, please. If no volunteer, any volunteer for second part? No volunteer, let's sign off.
Hello.
Ma'am,
Sarah. Yeah, one Sarah.
can I try?
Yes. One more volunteer, please.
Ma'am, me,
Name, please.
Sulekha.
Lovely. Sarah, your time starts now.
Right. Diana, thank you for sharing me all this information. I would like to do some examination to check your general health and also and then we will discuss about your condition. As what you're having right now, you're having a lack of sexual interest. This could be the reason because of as a effect of a menopause which happened after you have removed the ovaries after the surgery. And there are a few measures that we can do. One of this that you will be managed under my consultant gynecologist, and also will need to refer you to the menopause specialist on to advise for the most suitable treatment for you. And as for as this is affecting your quality of life, we may you may which I can refer you to a counselor for psychosexual counseling. What are your thoughts about this, Diana?
Yeah, that's fine, doctor.
Okay. And the other things as the options that you have is either that would you like to discuss more on the options? You can either prescribe you a hormone replacement therapy. Have you been given information on this,
I
Diana?
don't want to go for hormonal replacement therapy. Even Dr. Roser offered me this after surgery, but I have my own, opinion about it. I don't want to go for this hormonal replacement therapy. Any other option, doctor, do you have?
I see. Would you tell me more about why you don't want this hormone
No,
replacement therapy?
I've seen one of my friend, like, she was having breast cancer and eventually it got exaggerated. I don't want to go for HRT, that is for sure, doctor. Anything else you can
Mhm.
offer?
Okay, and if that's your choice, then we will respect that. Then the other option is that there is a medication we call as androgens. It is a form of male hormone, testosterone. This also has been shown to have benefit in women who have symptoms of decreased libido. The medication can be given in the oral or transdermal form. However, transdermal is preferable as the tablet form can have increased risk of affect your lipid profile, and also increased risk of having heart problems. Are you following me so far, Diana?
What is transdermal, doctor?
Okay, transdermal is the type of is a type is a type of patch where you can put on your skin, and this the medication will be absorbed through your skin. Okay.
Okay.
However, there is some side effects that you may experience, as this is a male hormone, that you may develop acne or increase in the facial hair. But this is also unlicensed treatment, but has been shown to have benefit on this. Okay. Um, However, there is um, we recommend to try for up to 6 months. However, if there's no improvement in symptoms, then may need to look for other options. And there's not much data on about the long-term effects on this testosterone on either breast cancer or heart problems. Am I clear so far, Diana?
Okay, doctor.
Mm-hmm. And so if you would like to, then this after using this treatment, then we will give you follow-up to see if there any side effect, and then we will see how you respond on this. Is there anything else that you'd like to ask?
No, doctor, I think that's fine. So you're going to give me that patch today itself?
Okay, I'll talk to my consultant, and then I'll give you the prescription, and also I'll give you this written information on this treatment. and then I'll arrange
Are
the
you
follow-up
are you
appointment.
going to test me for some tests like some level of hormones or something, doctor? Or you're going to start this patch right away?
Okay, we can take some baseline investigation to check your lipid profile and also your, I'm not sure, I think just check the lipid profile and check for the testosterone level, and then I'll arrange for your follow-up appointment, and yeah, that's all. Thank you, Sarah.
Okay. Okay. I will not give feedback because this is a
Okay.
very tricky task. So let me see what others have to say. Sulekha and Gayatri also has volunteer and Kavita also has volunteer. So fast, all of you will finish your task. Now, Sarah, you are going to be my role player and you have to say whatever I have asked for. Role player will not change her listening opinion and her requirement. Sulekha, start. Then Gayatri, then Kavita.
Yes, ma'am.
Start. Sulekha and Sarah is going to be role player.
So, Sana, Diana, from your history and examinations, as I can see that you have a symptoms like you are really distressed and having a difficult time. So for that, I can connect you with the counselors and support groups. And as you are on paroxetine, so let me ask that, are you compliant with medications?
Yes, I'm compliant with my medications.
So, have you felt like that your symptoms has improved in the last 8 months?
Yes, I think the medication is working for my hot flashes, but not for this sexual problems.
Okay, so for that, I would like to connect you with the psychosexual counselors. Is that okay with you?
Yes, that would be helpful.
To address, for that, we can also start with lifestyle modifications. We can start with the healthy diet. For that, I can connect you with the dietitians and exercise groups. And you can have relaxing exercise like yoga, regular aerobic exercise such as running and swimming. And and as your both your womb and both the ovaries has been removed because of that condition called endometriosis. So in that conditions, we may offer you the prescribed treatment, including the hormone replacement therapy. Have you ever heard about it?
Yeah, my doctor actually has offered me this treatment, but I really don't want to take any hormone therapy. Is there any other options for other than this, doctor?
I understand your concerns and your concerns are very valid, but let me tell you, Diana, that every person's reacts differently and their actions are really different. It's not like that if your friend has a problem like this, then it will happen with you. I will give you all the options and then you can decide. We will respect your wishes. So can I explain?
Yes.
So hormone replacement therapy is actually effective in 8 to 9 out of 10 patients. And before starting, we can measure your weight and the blood pressure, and it comes in form of tablet, patch, gel, nasal spray. Whatever suitable options you feel, we can start on that. And its benefit is like it protects us against the colon cancers and also makes our bones strong. But there is certain risk associated with it, like nausea, vomiting, indigestion, and headache. There may be chance that the risk of breast cancer may be high if it is used for a longer time, but the risk gets reduced when we stop the HRT.
You are wasting your time,
Yeah.
Sulekha. When she says that I'm not interested in HRT, you should move on for other this thing. You are imposing yourself. You have to acknowledge, you have to address, you have to respect her wishes. Give her other options.
So other options are like herbal preparations like plants or plant extracts such as St. John wort, black ovos, or isoflavone. They can help reduce hot flushes and night sweats for some women. However, their safety is unknown. And you can also buy the herbal products from a licensed or traditional herbal registration number. And the other alternative therapies like acupressure, acupuncture, or homeopathy may help, but more research is needed. And if you wish to try complementary therapy such as aroma, although the effects of these therapies is not known. And we can also connect you with the counselors to try the cognitive behavioral therapy for the low mood or anxiety related to the menopause. And for the sexual, like for the libido, we can give you the testosterone gel or testosterone gel, and we can also start if there is vaginal dryness, we can offer you estrogen cream.
Okay, all right.
So any options in your mind?
Yeah, maybe I would like to try the testosterone. Any side effects on this treatment, doctor?
Yes, although it has no side effect, but it's certain it may cause reactions at the local site. So any questions so far, Diana?
Is there any test that need to be done before starting the treatment, or can I start this straight away?
Yes, we can do follicle stimulating hormone, that is female hormone, before starting this.
Okay.
So I have given you a lot of information. I'm giving you patient information, leaflet to part the same, and will connect you with the counselor support groups and fix an appointment with my consultant. Thank you for your time.
All right, thank you.
Okay. It was a very good attempt. Now it's Gayatri's turn. Gayatri, are you there?
Yes, ma'am.
Yes, sir.
Thank you so much for the information that you have given. Anything else that you would like to add up?
No.
All right. So, listening, ma'am, I'm sorry, I forgot the name. What was the name of the role player?
Diana.
Diana. Okay. So thank you for this so much for the information, Diana. So the reasons probably that you have been mentioning, it could be possibly because of the vaginal dryness that is happening down there, because after removal of your womb and the ovaries, there are certain menopausal symptoms that you must have been talked about. Am I right?
Yes, yes.
Yes. So having said that, if you have already been started to on paroxetine for your hot flushes and night sweats, but there are certain remedies which could specifically work on the vaginal area to get relief from the dryness and the discomfort and also the pain that you have been mentioning about. Am I clear so far?
Oh, okay. But what about my sexual desire? Actually, the problem is my sexual desire.
Yeah, regarding that, yes, I can see that that is making an emotional toll on you. For that, I can connect you with the psychosexual counselors who can help you out regarding this matter. Is that fine?
Okay, sure.
Yeah, and we also have got support groups regarding such matters, and they will help you out regarding that as well. And to be more, and besides that, we have got some lifestyle measures which can be taken that could help you, and also the medical management. Do you want me to talk about it?
Sure, Greta, can proceed.
Yeah. Regarding lifestyle measures, we can put you in touch with certain yoga groups or meditation groups which could help you out regarding this matter. And when it comes to the medical management, there are you can start with either lubricants that are available, or estrogen cream that are available, or hormone replacement therapy. And we have got the testosterone gel. And also, if that does not work, we have got the tibolone as one option. Any preference? Do you want me to talk about all of them, or any preference on
Okay,
anything?
my preference is tibolone. My preference is tibolone.
Okay. So usually tibolone, having said that, tibolone is usually applicable only when it after 1 year of amenorrhea has passed on, and this is usually acting upon certain receptors which will help, but it has got this usually act on.
Two criteria to start Tibilon. What are those two criteria?
First is HRT and testosterone does not work, and secondly is 1 year after amenorrhea.
No. What is third in that case? Anyone? What is the third criteria to start Tibilon?
Ma'am, we have to rule out any history of VTE.
That is the usual one, no? That is
But
for everything.
breast
That is for
cancer?
Tibolone increases the risk of stroke and VTE, right, ma'am?
No, these are like common contraindication or common condition for all kind of hormonal. Specifically for Tibilon, I'm asking.
Cancer, breast cancer?
No.
I'm not sure.
Yeah, you're wrong as well. Who is this?
Yeah, I'm not sure.
Liver disorders.
Anyone?
But that could be checked.
So this will be your homework. I'm not going to give answer for this. Or anyone.
Ma'am, when the patient is not willing for other,
Patient is what?
not willing for the other treatment.
Wow, what a lovely answer. Who is this?
Sulekha.
Sulekha? Sulekha, darling.
It's a safe answer.
This is definitely a safe one, but not the correct one. Tibilon. So this is your homework, everyone. Ask your mentors where we do not prescribe or where we prescribe Tibilon, or what are the prerequisites to prescribe Tibilon. First question. And second question, why normally we do not offer, or why patient is scared of taking HRT in endometriosis?
Because that could even again regain, means cause endometriosis, chances of.
And one more.
Starting maybe.
And one more. Or rather, I would rephrase,
compliance.
why we give estrogen and progesterone both even we have removed the womb?
Because there are
Recurrence of
other deposits
Hello?
which
To
could be
prevent the
triggered.
reactivation of endometriosis spots elsewhere in the body, ma'am.
And
Again, the symptoms would recur for that.
same, dear. Same, no?
Yeah.
So this is
And
your, and Gayatri?
the side effects of progesterone and
Malignant lesions, risk of malignant lesions. That's why in a case of operated endometriosis, where we have already performed hysterectomy, we always offer progesterone with estrogen for these two reasons. Clear, girls?
Ma'am, malignant lesions, I did not understand. What kind of malignant lesions?
What does it mean by malignant lesion, dear? Who is this?
Ma'am, Gayatri only, but any sort of malignancy we will have. That's why the patient does not want.
Yes,
for estrogen or
lesion. It's malignant lesion, probably there is no details which kind of malignant lesion given in guidelines, but it is clearly mentioned that malignant lesion. So probably malignant lesion will relate it to somewhere near the pelvic organ only, not anywhere in the lungs or heart or anywhere else. Probably related to some hormonal malignant lesions. But it causes malignant lesion in a hysterectomized patient for endometriosis. So we always offer estrogen with progesterone. One reason is definitely the development of any endometriosis lesion if it is anywhere else in the body, because you have removed uterus, tube and ovaries. But if it is like implanted on, say, bowel or anywhere else, so it will again restart, right? But other than that, one reason is malignant lesion. These are the two reasons we do not offer only estrogen. Probably in this task, I have said breast cancer. Probably your role player will say this thing. So how you are going to, so Sarah now say that I am afraid that it may cause cancer. So how you are going to address Gayatri? Sarah? Ask this. I don't want to go for
Oh,
HRT
okay.
because I have heard. Say this way.
Okay. Okay.
How Gayatri going to counsel you for saying?
Okay. Actually, I don't want any hormone treatment because I'm afraid there is risk of breast cancer, doctor.
No, just say it may
No.
cause cancer because
It
it's
may
not
cause.
clearly given what kind of cancer, right? So just say
Okay.
it may cause some cancer.
Okay. I don't want any hormone replacement therapy because I heard that it may cause cancer.
Dinah, I see that your concerns are very valid. However, this is even though if it is mentioned that there are chances of cancer, but the chance is very extremely low, and we do have measures for screening beforehand if there is any chance.
No. We have just discussed Gayatri. We have just discussed Gayatri. How you will counsel her when she has that I have that fear that I'll develop some cancer because I have heard or I've read somewhere. How you are going to counsel about hysterectomized patient with endometriosis who is asking for HRT? You have to give her right information. We have just discussed Gayatri.
Ma'am, in the history.
No. Anybody else?
No.
We can explain that there's a combined hormonal combined preparation that's can reduce the risk that does not have.
Say in a better way. Say in a better way.
There is there's a few types of hormone therapy where there's only estrogen only and also
In hysterectomized patient, we offer dual hormonal replacement therapy. Not only female hormone, that is estrogen, we also offer progesterone. If you only offer female hormone, that increases the chances of having those lesions again or developing any sinister changes. Gayatri, repeat.
Yes. For hormone replacement therapy, we offer dual hormones, which is estrogen and progesterone.
For estrogen,
Estrogens
say
are
female
responsible.
hormone. For
Female,
estrogen,
sorry.
say female hormone.
Okay, we do. We offer dual therapy, which is the female hormones and progesterone. The female hormone is responsible for the sinister changes and the
Giving
recurrence of this.
female hormones alone can be a reason for developing lesions or causing sinister changes. Say it clearly.
The female hormones alone can be the reason for recurrence of the disease or any sinister changes. But because in order to prevent that, progesterone is added along with it.
Lovely. Sarah, now you have to answer Gayatri. Now you will be role player and Sarah is going to address your concern for cancer.
Yeah. But doctor, I do not want to go for hormone replacement therapy because I feel that it increases the chances of having cancer.
Okay, I can see that you're concerned about cancer. However, in a woman who has in hysterectomized we offer dual hormone therapy where there's combination of female hormone and also progesterone. If by giving female hormone alone, it may increase the risk of recurrence and also sinister changes. And in order to reduce the risk, we add on this progesterone hormone along. Okay, am I clear?
Yes, thank you.
Ompriya, unmute yourself.
Yes, ma'am.
Okay, now Hifza will be your role player, and now you are denying for estrogen, HRT, and Hifza is going to address. So, Hifza, start from you are offering her treatment.
I'll start. Okay.
Ompriya,
So we will
very
give.
difficult role player for Hifza. Very difficult.
I'm the role player, ma'am.
Yes, you are a difficult role player. It's not easy to handle. Only a mentor can handle you.
Yes. I
Uh,
don't want. Okay, you go first.
Okay, thanks Diana for sharing all the information. And now I will explain you about your condition and regarding your further management. So after taking your history, which I understand that you have developed a condition which is called menopause due
Lovely.
to removal of
This
the
is how everybody should start. Sarah, you missed this completely. Completely. You have to explain her why she is having all these problems. Probably she's aware of that, because Dr. Rosa has explained. But you have to confirm whether she is aware why she is going through a lot. Sarah, this is patient safety and patient communication both. Probably not applied clinical knowledge, but patient communication, you fail here. Because you're not communicating properly about her condition. You're not taking care of patient safety because she is like totally not like you're in confusion why I'm having one another problem after removing my womb. Well done, Ifza. Continue.
Okay. So you have developed a condition called menopause. It is probably because of the removal of the ovaries, and due to that, there is deficiency of certain hormones in your body, which are very important for the functioning of your body.
Hello.
Are you following me?
Lovely.
Hello? Yeah,
Yeah.
all right. So, so Diana, for regarding your
Mention
further
both
management.
hormones which she is deficient of, which she is lacking.
Okay, so due in this condition, the hormones which are deficient, it is mostly it is estrogen, which is very important for
Female
the sexual desire.
hormone, heads up, kindly mention female hormone estrogen. After that, you can mention only estrogen. First, you make aware female hormone estrogen. Once you
Female hormone.
signpost estrogen, then later on in your task, you can definitely say estrogen.
Okay.
Hmm.
So in this condition, the female hormones are deficient, and it is estrogen, which is very important, and for the sexual desire. And due to the deficiency of this hormone, you are also having these hot flashes and night sweats. So regarding the management, your
What about
care will be,
testosterone? What about testosterone?
yeah,
So, like
estrogen, progesterone, and
every
testosterone.
women has certain amount of male hormone testosterone. Am I right or wrong, Om Priya?
Yes,
Yes, ma'am.
yes.
So, when you remove ovary, is there any deficiency?
Yeah, there is deficiency of the estrogen, progesterone, and the testosterone.
Then, so you will say there is one female hormone, that is estrogen, which is mainly responsible, and some amount of male hormone, that is testosterone, that is also lacking up after menopause, and especially if it is a surgical or medical menopause.
Yeah.
Continue.
So, regarding the treatment, your care will be by a team of doctors, including consultant gynecologist, menopausal specialist doctor, and also psychosexual counselor, specialized nurse. And first of all, I will recommend you to have some lifestyle modification. For that, I will encourage you to eat healthy, take light exercise, and do relaxation exercises. And
Lovely.
also, I will attach you with a psychosexual counselor, and who will do some talking
Support groups.
therapies and
Mention
also
support groups here only.
yeah.
Continue.
Okay.
Lovely.
Okay, I will attach you with a psychosexual counselor who will do some talking therapy. After that, you will be able to cope with these symptoms. And
Whenever
regarding
there
medical,
is psychosexual therapy, what is the important point you have to mention simultaneously?
Couple therapy.
Lovely. Who was this?
Om Priya, ma'am.
Whenever there is sex, this is not one-sided game. Hifza,
yes, ma'am.
unless you are using some equipment. I may sound very vulgar at times. I'm sorry. I have very dark humor.
Okay, ma'am.
I hope you are all fine with this. I just try
Yes, ma'am.
to
We love that.
lighten up the things. It should not sound very serious conversation that everybody is like, okay, my God. So just in between, little bit hard, dark humor. Go with me. Okay, Lisa?
Okay, ma'am.
Lovely.
Yes, ma'am.
Go ahead.
Okay. So, and regarding the medical,
Yeah, Lisa, continue. I can't hear you. Your voice is cutting in and out. Anybody can hear, Lisa?
I don't want any hormones. What hormones, doctor? I don't want any hormones at all. My friend, she was using this and she got cancer.
Diana, I can understand your concern, and your concern is quite valid. So, yeah, your concern is quite valid. Yes, while using the hormone replacement therapy, the chances of getting the breast cancer it is increased, and but one person is different from the other person. The family history is also very important. Certain your own factors are also very important. But if you don't want hormonal therapy, then we will respect your decision, and what management you will choose, we will go with that. How does that sound, Diana?
Okay, doctor. So everyone with
So,
hormone replacement will get cancer. Why are you giving it to everyone?
no, Diana, we give to the hormone
Never,
replacement therapy
never
to
say no.
the
Never say Hifza so rudely no. I
ma'am,
understand your concern,
it is
Om Priya.
reflexly coming out from the tongue. Yeah,
No,
reflexly it's coming
that
out.
is
We
that,
are even,
Hifza,
yeah,
Hifza, that you have to
yeah,
control, yeah. That you
yeah,
have
ma'am.
to control, no? This is not an excuse.
Yes,
Are you going to give this excuse to your examiner? Please do not cut my marks. No,
no, no.
this is how it is. You have to have your presence of mind. Take some break. If you do not have any answer, if you take a pause of 5 seconds, 10 seconds, it's not going to cut your marks. There will be a possibility that you won't be able to have like immediate answer. Take 10 minutes pause. It's fine. Rather than giving wrong answer, better to take a pause, because if you say something like no, probably you lose your global marking. But if you take 10 seconds pause, it is not going to affect your marking. Okay?
Okay, ma'am.
Yeah.
Uh, Diana, actually, your concern is quite valid. We give hormone replacement therapy to the females who are low risk in having the breast cancer, and the cancer risk also decreases while you have discontinued the therapy. So it is only recommended for quite certain time when the patient is having symptoms, bothering symptoms. Are
Lovely.
you following me?
Lovely.
Yes, doctor.
Lovely.
All right. So, Diana, if you want, then I can explain you hormonal therapy. But if you don't want, then I will explain you the other treatment options.
Okay, is there anything that can reduce my risk of cancer, or can I know before it develops?
Yeah, Diana, in even in hormone replacement therapy, we give combined hormone like estrogen and progesterone, and taking both hormones will decrease your chances of developing cancers. So, and there are some other options also, which are the
That's it. That's
non-hormonal
it.
in
That's
which.
it. That's it. Done. So,
Hmm.
Gayatri, you were
Okay,
asked.
ma'am.
Gayatri, are you there? Lovely, Ifza. It was fantastic. Om Priya,
Thank you,
Yes.
ma'am.
Yes, ma'am.
satisfied
Great.
as a role player?
Sorry, Ifza, for being a
No,
difficult
no,
role.
So,
no,
Gayatri,
no.
you were asking for which kind of malignant lesions. I was going through guideline. I was trying to search. So, I got certain point that malignant transformation of endometriosis is rare, but well described
Okay.
process when it occurs in residual endometriosis. Residual
ma'am.
endometriosis, right?
Yes, ma'am. Yes.
And mostly it is adenocarcinoma.
Okay.
So good you asked this question. So I also did some kind of brainstorming that it is, I was sure that it might be causing something with the endometriotic lesion, but which kind of endometriotic lesion? That is, which kind of carcinoma? It is adenocarcinoma.
Adenocarcinoma.
So this is an additional information. If somebody asks, you have enough answer for that. So I have
Ma'am, it is.
sorry.
Ma'am, it is the adenocarcinoma of any pelvic
No,
region.
no, no. Any residual. See, when you do hysterectomy, what you do, you remove uterus, you do remove tube, you remove ovaries, right? But this
Yes.
endometriotic lesion or implants can be any other part of the body. It can be even on bone,
Yeah.
can be even on bladder, which you can't remove,
Yes, ma'am.
right? Even you
Yes,
can't
ma'am.
like burning, you can't do, because if you burn bladder wall, That is not a something which you will do, right? So,
Yeah,
but
ma'am.
because you're not having those ovaries, because you're not having that menstrual cycle, so that is going to be there, but that is not going to cause any problem. But if you give only estrogen, first,
Yes,
it
ma'am.
may increase the lesion, or secondly, though rarely, but it may cause cancerous changes, and that is adenocarcinoma. So even if it comes as SD, you have enough information to give your examiner. One very important thing everybody missed in treatment. Hifza added menopausal, how you are going to address that? Hifza added, Sulekha also added lifestyle changes which you miss. Sarah, that is very important. Always remember, whenever there is lifestyle changes, whether patient is opting for medical, surgical, lifestyle changes or modification is a holistic approach and you have to offer her. Sarah, okay? One very important point everybody has missed in this task and lost point in patient information and this applied clinical knowledge and patient safety. One brilliant student. My star performer, please. Who is going to be my star performer today? Anyone, go through task again. Task is in front of you.
Partner history.
No. Then I'll wind up. I'll just give you some idea about testosterone because this is the answer. This is the answer actually. The second slide is the answer, but before that, that question or that acknowledgement everybody has ignored.
Ma'am, shall I, ma'am?
No, you will answer this. No, you will answer this. You won't. Manikam, you are going to answer if everybody fails. Yes, Ompriya, malignant transformation in residual endometriosis, and that is adenocarcinoma, though it is pretty rare. Anyone, there are 20 students barring me and, 18 students barring me and Manikam. Anam, Anu Lakshmi, Vasvi, Gayatri, Hifza, Kushbu, Malia, Manikam, I will not take her name, Menka, Mohana, Ompriya, Ragini, Ravisha, Sara, Shaikh Mohammed, Shrishti, Sulekha, Hina. I'll give my answer key free. Now there's a very good offer. Trust me on that. My answer keys are very good.
To offer oral contraceptive pills till 51 years of age.
Oral contraceptive pills? I will deduct your marks. I'll take my answer keys back. Who was this? Who was this? Who was this? I'm not afraid. I'm just joking. Okay, read your task from you till end 10 minutes. Sincerely, you will get the answer here itself.
Paroxetine.
Who is this? Who is this? Whoever is this is on right track. Who is this?
Ma'am, Gayatri.
Gayatri. So why paroxetine?
She started on means I don't know the exact answer, but it is like
you should
she
know the
started from
exact
last
answer.
8
What is paroxetine?
months.
What is paroxetine?
SSRI.
SSRI.
What is the side effect of SSRI?
It's nephrotoxicity.
Libido.
Loss.
Then what should be
Stop
your first
SSRI.
acknowledgement
Stop
in
on
second
paroxetine.
part of task?
Stop SSRI.
Yes.
SSRI.
You will start your treatment that this is menopausal. Menopause can be responsible. Hafiza, you should be more elaborated. There is one more thing which we all miss. You will always ask about her cervical screening before removal, right? How was it? Okay.
Yes, ma'am.
One important question. And Hifza, when you started menopause, you should have mentioned that that can be responsible for hot flashes, mood swings, night sweats, decreased libido, thinning in bone, right? Having heart problems. Okay.
Yes, ma'am. Yes, ma'am.
So now you will be under the care of this. This is how you have to start. First, you give like history examination, understand that you have a condition, we call it as post-menopause. In your case, it is because of the surgical surgery, so we call it as surgical menopause. There is deficiency of these two hormones, right, which is responsible to maintain a female body. A deficiency of these hormones are responsible for this. So now you will be under the care of this. We have certain options of like lifestyle changes, hormonal therapy, testosterone, and TB. You have any preference? I don't want to go for a charting. May I know your concern? Okay, I'll expect your this thing and we'll go with the rest treatment. But let me assure you, in this case, we always offer dual hormone because giving alone this can cause this reactivation of a residual lesion or changing in sinister change or showing any kind of sinister changes. Moving further, we have an option of testosterone. Before lifestyle change, putting her under expert team, you'll say, can you tell me clearly, did you notice all these problems related to your sexual activity after starting paroxetine? If you have not asked in information gathering, probably she'll think for some time and she'll say, yes, doctor, it seems so. I was absolutely fine, say 8 months before, and I have started developing all these problems 5 months back. Then how you are going to counsel her, Gayatri, for stopping paroxetine?
The symptoms that you have mentioned could be possibly because one of the side effects of the drug that you're using is a decrease in having sexual desire. So it is recommended, it is advisable to
I would
stop.
I would suggest.
Okay. So I would suggest you to stop this medication, and we can then discuss about the
Are
further
you going
option.
to stop paroxetine just like that? Is there any risk of having withdrawal if you stop any SSRI or SNRI?
Yes, there is. So
I will put tapering should be done, ma'am. Tapering of slow dosage.
We will
Should I talk
refer
about
to you.
tapering or-
Simple. Do not take anything on your head. That can be paroxetine is a drug which releases happy hormones, but it has decreased sexual desire as a side effect. We would refer you to expert to taper off this medicine if you are okay with it. Your job done. Your job done. Now she is asking for testosterone. I'll ask one question. First, whether it is licensed in UK or not.
Not licensed.
No. What is the form which is preferred to give in any women of testosterone? Gel. Lovely. So how you are going to mention these two lines? Anyone?
It is applied on the thigh.
No. Whatever I said, say this. How you are going to say in layman language?
Ma'am, about the management option.
About testosterone, whatever I said so far.
That it is one of the male hormone which is responsible for the increasing the.
No, I'm talking about treatment. Sarah, how will you say these two lines?
Okay, this testosterone can be taken as a gel, where you can apply on your skin. However, this medication is not licensed to be used
Yes.
in UK.
This is not licensed in UK to use in a women for this condition, but we can offer you in a gel form. Clear? Now, what is the second part? How you are going to apply and where you are going to apply? Who is going to answer this? Where you are going to apply? So always, whenever you talk about any medication, First, you talk whether it's licensed or not licensed. And second is, what is the route? Or what is the form available? And third is, how you are going to take it. Like if it is a tablet, then what is the dose? If it is something like gel, then how you are going to apply it. You have to address all these questions in drugs. So how you are
Ma'am,
going to apply and where you apply this?
ma'am, it is applied on the thigh.
Say it properly. Say it properly, dear. Testosterone, this is such an important record. Such an important record. Testosterone should be on your tips. Gayatri, Afiza, Ompriya, Sara, or otherwise I'll pick Manakam. She'll give all the answer and then I'll wind up. I'll wind up or sign off.
Ma'am, it's applied over lower abdomen and thighs and forearms, ma'am.
It is applied on. Come on, girls, yeah. This is not done. Okay.
It is applied over the skin, over your thigh and your lower tummy or your arms, but in a minimal dosage. And
there is no minimal doses as such. There is no dose is given. Dose is very long, like you have to apply this much. You're not supposed to go that much deep. Yes, otherwise you are absolutely right. What other precautions when we apply we have to take?
we should like cover.
We should cover that area and
cover that
we
area
should not touch anyone else with
hand
without
ointment.
washing. Why? Because repeatedly touching, if you touch your son repeatedly after applying this, he may develop effect of testosterone because it is absorbing from skin only, no?
Yeah.
So how you are going to say in a proper way? Fast, girls.
It should be applied over the skin on preferably on the thigh or the lower tummy or the arm, and always remember to cover
Arm
it
is
up.
not given anywhere, wherever I read. So just talk, say upper abdomen, so lower tummy and say lower tummy.
Lower tummy. Okay. The gel is applied over the lower tummy and it should be preferably covered after application. And
how many
always
hours?
make
For
sure
how many hours you have to cover it?
Ma'am, I don't know that.
Anybody, for how many hours we have to cover it?
2
to 3
3
hours.
to 4 hours.
2 to 3 hours. 2 to 3 hours, okay? Yes.
For 2 to 3 hours, and make sure not to get in touch with and make sure
not to touch anyone, not to touch anyone without
not
washing
to
hands.
touch anyone.
Make it simple. Okay.
Without what, ma'am? Without
washing hands, no?
Without washing hands. Okay.
And now fourth is, what are the side effects? So this is how you have to address all medicine drugs. If you are offering any drug or any medicine to anyone, you have to cover all these points. What are the side effects? Side effects is patient safety, no?
Yes.
This is
You
common
may
sense.
develop acne and hirsutism.
Acne, hair growth, weight gain,
Hair growth.
deepening of voice, enlargement of clitoris. Ompriya, repeat side effects. Ompriya, repeat side effects if you are there. Ompriya is not there. Ompriya is not there. Gayatri, repeat side effect.
The side effects related to this could be increase in hair growth, acne, the enlargement of the clitoris, and one more.
Weight gain.
And weight gain.
Deepening of voice.
Okay. The side
Now,
effects related to this would be deepening of voice, increase in the clitoral area, increase in hair growth as and acne. And
what are
deepening
the
of voice.
contraindications? What are the contraindications?
When we check the testosterone level, I think before that.
No, that I'll come to that. What are the contraindications? What are the contraindications, dears?
Breast.
If an athlete has come, liver disorder, pregnancy, lovely. If an athlete has come, and are you going to offer her testosterone?
No.
Why no?
For them, it is not allowed, I think.
She is going to fail which test?
At the medical test that is done for the
Fitness
athlete.
test. Name of that test?
Fitness test.
What is no, what is the name of that test?
The steroid test.
Doping test.
Doping test. Okay.
We never offer testosterone in doping test. Unfortunately, one of the Indian, this thing, not because of doping, yesterday, she lost her chance in Olympic because of her 100 grams weight. Gayatri?
But
Yes,
she was
Dinesh
not
spoke.
doped, ma'am.
No, I'm not saying doping.
Positive for
I mentioned it here that I'm saying not because of doping, because of 100 grams weight.
But there is conspiracy behind her.
Yes, that was
That was
heartbreaking.
very
Actually,
sad, very sad, very
she has
sad.
gone through a lot over the last year.
Very sad.
But
cut her
gold
hair.
medalist is raging that she should get silver medal once she has qualified for the final.
This is I'm not understanding, but because she has qualified a certain level with same weight, then why they are snatching that particular? Because at that time she was 50 grams. So okay, so you are not allowing her.
Ma'am, Indian government is not supporting.
Our government is not supporting.
Yes, ma'am,
that
because
is not
that Brez Bhushan, because he has told that I will put a medal in front of his mouth face.
No, there has been some sort of controversy regarding she filed a complaint against some in India regarding the government.
Sexual assault she has.
Sexual assault thing. And then nobody
That's
supported
the
her. And
problem.
she
In
has
spite of
gone through
having
this.
140 crore population, we are not able to deliver good sports men and women. This is so very sad, no? Very sad.
Yes, ma'am. There is so much exploitation in the sports field of female athletes.
Female are too much exploited in sports field because they are very few. There are very few who reach to this level.
No, ma'am, there are not few, but only few are left because of that.
Yeah.
Because I have been in Haryana, I have seen people, they are so much backing. Even sports are a curriculum in their school in Haryana.
Because Haryana has very strong women, no? Physically, they are very strong. Very strong. Even emotionally, mentally, they are very strong because I'm also practicing in Gurgaon, which is in Haryana only for past 12, 13 years. And I find them very strong and it's very sad. Very sad. Anyways, so what are the contraindications? What are the contraindications?
Athlete.
Now you will never forget athlete. If they are competitive athletes, pregnancy, breastfeeding, liver conditions, and history of hormone-sensitive breast cancer. Hormone-sensitive breast cancer. So if you take history of hormone-sensitive breast cancer, you have to be very careful in prescribing testosterone. If she still insists for that, you will straight away refer her to MENOPAUSal. You will explain about testosterone. If she's insisting, but you will say only menopausal clinic and the team would decide to start testosterone for you. Okay? Now,
ma'am, in case, hello, ma'am?
Yes, yes.
Ma'am, in case, why, if we forget to ask these specific things in history, like regarding the contraindications to rule out, because
Then,
can we ask it later on?
if you ask in information gathering, that is the best way. But if you ask even while prescribing medicine, that is also not bad. Missing anything is, see, probably you will not get the brownie points.
Okay,
But they will not, they cannot cut your marks even if you ask before prescribing testosterone if there is any history of breast cancer. Because you have mentioned this before prescribing them. You'll definitely get tick. But probably those global marks which give you, weightage in your that particular task, probably more chances of clearing exam. There you may lose. Because those brownie points are very helpful. But definitely they cannot fail because you have asked. Even if you are ending your task and you ask, sorry, there's one more question. Before testosterone, we have to ask this question. They cannot cut your marks. But here is fight not for cutting marks. You are a good student. Everyone is presenting nicely. You should fight for global marking. You should fight for brownie marks. Brownie points. Should not fight for tasks. That you will clear. All of you. Now, very important patient safety point that we always measure testosterone before starting. And what is the frequency after starting? Who will tell me this? First,
I think it
what
was
test we
monthly.
perform?
Liver function test, lipid profile.
No. It's testosterone only I'm talking about. We always monitor total testosterone level before starting. What is the next protocol?
Ma'am, I think it was after 6 months we should again do it,
No,
repeat it
no,
too.
no. No. Anybody else?
No, it was if the side effects was there or something.
Yes,
complaints
Aruza,
was
it is once or twice a year, not in the beginning. In the beginning, first you check after 3 to 6 weeks or sometime 2 to 3 months. First, you check before starting, then reassess after 3 to 6 weeks, or some protocol says 2 to 3 months. After that, it is going to be either once or twice in a year. Who is going to repeat this?
First, we have to check for after 3 to 6
First,
weeks,
mention
and
the
then
name of test, whether it's free testosterone or total testosterone.
free testosterone.
Total testosterone. And how you do it?
First, ma'am, we will check total testosterone level in 3 to 6 weeks, and then we will monitor once or twice in one and second year, first and second year.
First, you will test before starting. Then, either 3 to 6 weeks or 2 to 3 months, you can remember anyone. And then once or twice in a year. Why we do not check free testosterone? Because biological activity of free testosterone has not recommended. The level is not, whatever level we find, we do not correlate with biological activity of free testosterone. So it's always total testosterone which is recommended. There is one more test which we recommend in certain conditions. What is that test and what is that certain condition? There is one other test which we do recommend in certain conditions only.
androgen index.
That is never recommended. Have you heard SHBG? What is the full form?
Sex hormone binding globulin.
When patient is on also some kind of estrogen therapy, then we also offer checking this level. Okay? Clear, girls?
Yes,
If
ma'am.
you speak this much about testosterone, Gayatri, you are going to get brownie points for sure. Now, one volunteer, without any fumbling, explain testosterone in a layman language, then we are going to wind up or sign off. One volunteer who is confident, who is my star performer. And there is one homework that what are the prerequisites or indication, not indication, prerequisites to start a pilot. One girl and then we'll finish it off. Come on, girls.
So, ma'am,
May I?
Anyone, but there should not be any fumbling. Any fumbling, I'll move on to another volunteer. Who wants to try?
Yes, ma'am.
Aruza or Sulekha?
Sulekha.
Sulekha. Okay, any next volunteer? Because if Sulekha will fumble, I'll move to next volunteer. One more volunteer.
May I?
Aruza. Okay, so second volunteer is Aruza, right? So Sulekha, start.
So testosterone is a male hormone and it is available in gel form. It can be used to improve
Sarah,
sexual
be her difficult role player. Ask all the question if she's not addressing everything.
Okay.
Start, Sulekha. It won't be easy.
So, do you have any options in your mind? Diana?
Yeah, I would like to know any other options than hormone replacement therapy.
So let me tell you, the testosterone is a male hormone which is available in gel form and it can be used to improve the sexual desire. Though it is not licensed in UK for use, but we can offer you. Is that okay?
Okay. Is there any side effects on this?
But it has certain side effects like acne, excessive hair growth, and it is contraindicated in athletes. So before starting testosterone, we have to measure the total testosterone level, and it is done 1 to 2 times a year. So any questions so far?
No, no.
Thank
How
you.
how do I use this
So
gel, doctor?
yeah, it can be applied in a gel form and the lower tummy and the thigh.
Okay. Any precaution that I need to do after applying the gel?
Sulekha?
Yes, ma'am.
She's asking question, no?
Precaution, and that is it is actually avoided in athletes, and precaution, I don't know, ma'am.
Okay, so I'm moving on to Aruza. You have to be very attentive while session because trust me on that, Sulekha, if you attend my session sincerely, you are not going to forget that task rest of your life. This I can
Yes.
guarantee you.
I'm in OPD, ma'am.
I can guarantee you, even if you listen to me carefully. Anyways, Aruza, it's your turn now. Welcome.
Okay, ma'am. Sarah, we can suggest you a hormone, which is male hormone testosterone. But let me tell you that it is not licensed in UK for female use. It's available in gel form and it can be applied on hair-free area like lower tummy and upper thigh. But I'm afraid that there are certain side effects with it, like you might have acne, change of voice, or hair growth, and sometimes the size of the clitoris might increase. But we will tell you emergency contact number. So in case you feel any such problem, then you will contact us immediately. It is, let me tell you the method of application. So you have to apply. After application, you have to wash your hands quickly and do not touch with your bare hands without washing, because it can be easily absorbed through the skin and can produce side effects. And apart from that, we will also take care that you are not pregnant before prescribing it, not breastfeeding, and also it is avoided in athletes as well. And also, we have to measure the testosterone levels before suggesting you this hormone, and even after starting the hormone 3 to 6 weeks, and then or later on, sometimes 2 to 3 months later, and then in a year once or twice. So, are you clear so far?
Okay, yes, ma'am. Yes, ma'am. Yes, doctor, thank you.
Okay, and sometimes we also may need to have another test which we call as sex hormone binding globulin, if we prescribe estrogen along with it.
Okay.
Is it
Yes,
done?
ma'am.
Done completely?
Yeah.
Okay.
Yeah.
You were satisfied, Sarah? She answered all your questions. She addressed testosterone completely.
Yes, her
Okay.
explanation is complete, so I didn't ask any question.
Okay. So, Gayatri and sorry, Sulekha.
Yes, ma'am.
So this is how you have to address testosterone. You have to give offer. First, you'll offer you need to stop paroxetine. We'll refer to this thing specialist. Then we have option of lifestyle medical, then HRT and the testosterone table on. We'll speak about it. When you will come to HRT, she will refuse. Do not force her. Just give your statement that it is considered unsafe when it is alone given. And yes, when you stop, if she asking about breast cancer, when you stop, the breast come to this thing when it is like stop for almost half, because HRT is not something which you take for lifelong, right? This is something which you should understand, that HRT is something they say that even if you take in a go for 1 year, 2 year, 3 years, it is going to have good effect rest of your life. Right? It is not that once you've started HRT, then you have to continue HRT for like 20 years or 30 years. That's why they give this statement that once you stop, the risk decreases in 5 years or this year. Because for HRT, they are clearly saying, once you start HRT and you get response, you can stop after 1 year or 2 years, and probably those symptoms are not going to come back. Clear? So you'll stop paroxetine, then you'll offer HRT. When she's refusing HRT, just acknowledge and give your fitted reply just once, and then move on to testosterone. Give all the information of testosterone one by one line, everything. After that, you will not offer her Tibilon. Why you will not offer her Tibilon? This is your homework. That's all for today. I have to go somewhere. Today is actually my off from my clinic and my course. But somehow I thought of taking one course because everybody was looking very lazy. So now this is your backup session. I'll be taking these backup sessions like anytime. And I'm sorry for very short notice of 10 minutes, but spite of that, almost 26 students could join. So this is very encouraging. Keep it up, keep studying, keep talking, keep speaking. That is the only way. Listening is not the solution. Listening is not the solution. Listening is not anyways going to help you in clearing part 3. It's always about speaking. So come forward, speak, present. Only then it is going to help my sessions. And I always try to give, chance to everyone that speak at least 2 lines, but speak something. Goodbye, bye-bye, take care, and see you, because my kids are waiting for me. I'm sorry, any question, you can just post in.
Ma'am, one last question. Yeah. Hello? Hello?